So my first thoughts after watching the video was that it couldn't be more true. Accidents happen in the hospital, and many times patients come in often thinking that everything's going to go well, not realizing that the people caring for them are human and they make mistakes, sadly. Sometimes that costs lives and causes many, many problems. The story of Dennis Quaid and his family is just one of many that have happened over the years, but very sad nonetheless. I think after watching this, it just is a good reminder to always practice safety and always looking for those next steps that can be improved upon in terms of safety. And how can we improve? How can we make it better that the patients are going to run a lower risk of getting hurt? And that's what I took away from this video is that there's always the initiative, chasing zero, and it may never be reached, but it always should be strived for. Um, and for the lasting impressions, I have seen improper nursing management in terms of patient care. It doesn't lead to anything serious, but it's the acts that you go through that could lead to potential problems. And it's small things that can lead to big things. And that is a concern that we should be addressing. That oftentimes isn't, especially for the small stuff. Um, the one personal story that I have, this isn't necessarily related to patient harm in terms of life or death, but there was restraint orders put in for a patient that was withdrawing from alcohol, and they were not confused anymore. They were not withdrawing. They were perfectly in their right mind to make their own decisions. And the doctor had not seen them yet, however, that they had put in restraint orders for this person that was alert oriented and wanting to leave AMA. And the way the hospital system was set up and the orders were placed, we were required to get a hold of the doctor to get restraints put on the patient. And if not, we would have to call and get a court order for it. It sounds strange when I'm talking about it, but going into the situation, the way everything was set up, we could not just allow them to leave. However, the patient was completely in the right mind to make their own decisions at that time. Luckily, the doctor was able to see them in time and get them taken care of, but if not, it could have gotten very ugly and we could have had a lawsuit on our hands. That would have been, I can't even imagine. That would have been very, very problematic. So it's things like that where we need to find ways to mitigate it and improve upon it. Um, and I believe, though, I think nurses are afraid of sharing their errors because they're afraid of criminal um, like charges and backlash or getting fired, which definitely can be a possibility. But it shouldn't hinder us. We should feel safe to come forward and express our concerns, the errors that we've made, because it's only going to help us improve. It's going to help us become better at nursing and in safety, and ultimately helping us reach that goal of chasing zero. So that is what I took away from this. I can't stress how important it is just to continue this push to improve our healthcare system and the safety around it, and also improving the perception of healthcare in America. Even though I believe right now the perception of healthcare may not be so strong, the perception of the care teams that take care of people is, I believe, strong, and that can only improve. So that's my takeaway, and I think that the future is bright. Thank you.